Nigeria will join the global community to commemorate this year's World Contraception Day. It's usually an annual event.
And to join us to discuss the topic, let me quickly introduce the two personalities here in our studio. Dr. Tunde Segun is lead consultant, 2 Miles Consulting. We're glad to have you with us.
Thank you so much.
And also with us here is Funke Fagbimi. Funke Fagbimi is Director, Center for Communication and Social Impact, CCSI. And Kingsley, if you permit me, I'd just like to start with Funke. You know,
why Funke?
Why
Funke? I mean, the way to start is contraception necessarily a female thing?
Kingsley, I'd like to start with Funke.
No. I said
yes,
why?
Funke, why?
Because this is part of the prejudice. When you mention contraception, the first thing is to assume that it's a woman's responsibility.
No.
That's the prejudice.
No. I took permission. I said I'd like to start.
No,
with
I understand, but I'm also underscoring the prejudice.
All right, Funke. Actually, when I was growing up, you know, it was almost a taboo, you know, for any female, the girl child to talk about contraception. And if you had the courage to do that, you were considered a, deviant. But today, we are even having a World Contraception Day. Talk to us about that.
I think the world is changing. Nowadays, we need to make things that affect the quality of life of Nigerians and not just women, right? We need to make it a norm. And family planning is something that actually buys you that peace of mind. So why not talk about it?
So is that all there is to the World Contraception Day?
The World Contraception Day actually brings awareness, to contraception and the benefit it brings to the family through government, through the activities and the efforts of government to make sure that we reduce maternal mortality, infant and child mortality. And family planning or contraception is that one stitch that can actually save 9 lives. It does so many things and allows the health system to also see that point of integration where all things can align together. So why not talk about family planning, which is not just for women?
So let's put the question now back to Segun. Kingsley, I know
I'm not the one put. Ask your own question. But the question I will ask Segun.
Okay.
No, the question I will ask Segun will be as follows: whose responsibility is it, as it were, to understand and then, if you like, deliver on the whole idea of contraception, which leads, of course, to family planning?
Okay, good question, and I appreciate the fact that you said it's not just about women, yes, which is very true. I mean, if we go to the basics and say, what exactly is family planning? You see, it allows individuals and couples to be able to anticipate and attain their desired number of children and the spacing and timing of those pregnancies. And this is achieved through the use of contraceptive methods and, of course, treatment of involuntary infertility. So the ability of a woman to be able to time, to space, and even limit her pregnancies has a direct impact on her health and well-being and on the outcome of each pregnancy she has. So it's a collective responsibility. It is not a responsibility of just the woman. Of course, if we look at it in terms of biology, it's the woman that, in quotes, suffers more the outcomes or the consequences of where there's unwanted pregnancies, where the pregnancy is not planned for, where there are complications of that pregnancy. It's the woman that bears the brunt. However, it is a responsibility of all, because we also live in a society where, or let me just say, it's more patriarchal, where the man has a lot of influence over the woman and what happens to her. It's varied.
Do we have male contraception? And if so, what is the role of men in all of this?
Okay, so there are both contraceptive methods for the man and, of course, for the woman. And because of the anatomy of the woman, you have more for the woman because share by share anatomy. So for a man, you can just talk about the barrier methods. And, of course, we know about condoms, but there are also condoms for both male and female. A man can also do what we call withdrawal method so that he doesn't spill his sperm into the woman. And then, of course, a man can also do the permanent contraceptive method, which is a vasectomy, cutting the tube that carries sperms from the testes, you know, to that. And of course, the fourth one, which most people forget, is a man can abstain. So, but I know the way people look at that as, well, yes, I mean, abstinence doesn't have to be total, but I mean, you can abstain till, like for the youth, we tell them, okay, try and abstain till marriage. But if you cannot, then you practice safer sex because there are consequences, either infections, HIV, AIDS, unwanted pregnancies. And of course, unwanted pregnancies lead to unsafe abortions, and unsafe abortions lead to death. And that complicates our issues for women. So going back to your question, it's a collective responsibility, and that's why this World Contraception Day is creating awareness. We want to know about it, we want to talk about it, and want to go for these methods.
You know, Funke, we know that there are cultural and religious barriers to effective communication of contraception. Our society hasn't reached that stage where this is a point of sometimes antagonistic legislation. In some other jurisdictions, you hear of abortion rights and what all of that entails, all the matters that could lead up to that very point and contraception. So how can we, if it is desirable, more effectively communicate the idea of contraception while tearing down the religious, cultural barriers against what should be done in the circumstance?
I wouldn't even say tearing down religious and cultural barriers. I think it's identifying them and finding out which role they play along the spectrum of behavior change. So ideally, and a lot of projects have actually done well. For example, the Nigerian Urban Reproductive Health Initiative was one project that was able to tackle demand and supply barriers. And for the demand barriers, it looked at the social norms, looked at the perceptions, the attitudes, the lack of skills, the lack of self-efficacy that stood in the way, preventing people from actually attaining that behavior. And one thing the NORI project really did well was to go right to the leaders that matter and get their buy-in. So there was a lot of advocacy at the religious level. This is what other people and other projects and other constituents need to emulate. So it's not seeing them as barriers, so to speak, because if you're not careful, culture is going to eat strategy. So no matter how effective your strategies are, what is the norm and how do you find out, do your investigations, know exactly what the correct perceptions are, know how you need to mitigate against them so that we can easily get to where we're going. And we all know how complex behavior changes. There are different levels you need to go through. So it's not instruction that makes people to change behavior. It's that shared vision. And there's a quote that says, shared vision allows ordinary people like you and I to do extraordinary things. And in this role play, you need to understand who the stakeholders are, who all the players are, and make sure that you bring all of them into the space.
You know why I raise the issue of cultural and religious barriers? There is a view that is prevalent in our society that education on contraception could lead to promiscuity.
There's also a saying that says knowledge is power. So when you have the correct knowledge, it allows you to make that choice.
Once you have that power, then you go to town.
So it's not true. And evidence has shown that it definitely is not true. And those are some of the misconceptions. That's the narrative we need to change. You can play a part. I can play a part. Definitely is not true. Okay. Knowledge is power.
Okay, Shagun. When family planning advocates, talk about contraception, the general emphasis is usually on the pills, the injectables, the coils, and all that. I'm wondering, why do you not give emphasis or stress to timing and withdrawals and those, aspects that do not involve having to take pills and all that?
Okay, let me help you. You see, there are different methods, and what you are trying to talk about are what we call natural family planning methods. So things like withdrawal methods for the man, symptothermal for the woman. The Roman Catholics have projected the Billings method. There's standard day methods using beads, But the issue is, if you look at the efficacy, if you look at the hormonals, the implants, and all that you are mentioning, they have higher efficacy rates than a withdrawal or symptothermal where the woman must have regular periods. And, if you have irregular periods, you cannot time the ovulation and all that. So it's not what you're saying, if you go to a family planning clinic today, where there is a green dot, the Federal Ministry of Health has a green dot, you will be given counseling on all the methods. So, but it's just like saying, if I go to a pharmacy, I can say, please, I would like to buy a condom, or I'd like to buy a pill, at least things. But you see, how easy will it be to go to a pharmacy and say, please, I want to buy abstinence, or I want to buy withdrawal methods? You see, like she was saying, those things are more of behavioral changes and education. It's not a product you can buy. So it's easy to market products, but when it comes to things that border on behavior, you may not see that come to the fore. But I assure you, every family planning training that I've involved in, that, over the years, every family planning clinic takes the woman and the man through all the methods, and then you can make an informed decision. And who says you can't combine? I can combine a condom with my wife using a pill or something, or of course it's more convenient nowadays to use what we call the long-acting and reversible contraceptive methods, so that the woman doesn't bother to be popping pills. You can have an implant in your arm or an intrauterine device in the uterus, and you are home and dry. So it may seem to be an emphasis on those things that are products, but it is there.
Okay. Tunde, thank you very much. Back again to Funke. Obviously, after menopause, these issues don't matter. But who is the target for more effective communication on the whole idea of contraception? How much do you get to see of such target audience voluntarily seeking information on their own? Because I'm asking this question against the background of what we get to hear and what we get to know, that sometimes they just rely on oral communication from their friends and colleagues and peer pressure. Oh, take this one. Oh, take that one. Oh, take the other one. This one has worked, X, Y, Z. And sometimes, of course, as you know, complications do arise. So in terms of communication, who is your target audience? How much do they on their own voluntarily come up, for counseling and then respond positively to the messaging?
So for behavior change, our audience is actually wide, but at the community level, looking at the consumers, it's both the female and the male. But with the knowledge we have, a lot of emphasis has now shifted to making sure that there is adequate male involvement. So some men do still need to give permission to their wives to access FP. And in some of the programs, we've seen that shift. Even men are coming out to ask, I want my wife to have this method. What does she need to do? Also at the provider level, we need to eliminate that provider bias at the level of the providers, and they are also educated on how to get the best out of the clients, how to give the correct information, how to make sure that they change their perception on the skills and make them more confident to actually know that the services are there. And like Dr. Shegun mentioned, go to a facility that has the green dots. This is endorsed by the federal government of Nigeria, and you can get accurate services. So in terms of whose responsibility, we can't say it's just one. What we've done recently is to have a sophisticated audience segment where we don't only look at their knowledge, their education, but their psychographic profiles. What are their aspirations? What are their needs? What do they want? And how can we help them to attain that desire? And again, family planning is one intersection between the human capital development agenda. Invest in people, you're investing in a nation. When you make that woman stand proud, when you make that family stand proud, you're able to do a lot, and the benefits spills over.
Funke, I will get pressed for time, but if you recall, some years ago, there was some debate as to whether family planning of sexual education should be incorporated in the curriculum. I mean, there were some parents and other stakeholders that said, no, don't expose our children to this kind of education, because again, in their view, it might lead to promiscuity. I was just wondering, still, because the issue of targeting is important. Is it those who are pre-puberty years, or those who are just getting in? Because it's a natural course. You can't run away from it once those urges are there. And if you don't have the right information, you rely on your peers.
Exactly. So I think, you see, the principle is to have age-appropriate sexuality education. Years ago, the government adopted what they call family life and HIV/AIDS education curriculum. And you see, what happens is because people just think there's half, you know, you give half knowledge, you don't give the full spectrum. And of course, like a child, if you tell a child, don't touch that, the curiosity is heightened. But if you tell the child, look, touch this, it's hot or it's cold, you know, so if you give the full knowledge, not just that sex is pleasurable, which it is, but the full knowledge about the consequences when you are ready, you know, there are infections and all that. Research, like she said, has shown that when youths have this knowledge, they invariably even delay having sex. Contrary to popular opinion, tell them have sex and they will try and experiment, you know. So the youth need to be targeted. Give age-appropriate sexuality education.
All right, I had a question for you, but our time will not permit us. So I'm told to end our conversation. We've run out of time, really. Dr. Tunde Segun, Lead Consultant, Thomas Consulting, and of course, Funke Fagbemi, Executive Director of Center for Communication and Social Impact, CCSI. Both of you, thank you very much for sharing your thoughts with us.
Thank you so much.
Thank you so much for having us.
All right, so let's take a look at what's happening on the entertainment scene as we join our entertainment arts and entertainment desk.
Meanwhile, Nigerian singer and disc junkie Yen, born Oyinka Asu Johnson, commenced her bid to break the world record for the longest stream of non-stop music. The record currently stands at a reported 11 days. Yen has been streaming her sessions live on her Instagram. In 2018, it was reported that DJ Van Mark, then a student of the Federal University of Technology, Akure, broke DJ Obi's reported June 2016 world record for the longest marathon DJ spin. Already, DJ Yen has done over 20 hours. If she breaks the record, she will join the likes of Stephen Keshi, Lagos State, Olawumi Treasures Boyode, Haruna Abdulaziz, and Kafi as the Nigerian entities in the Guinness Book of World Records.
All right, so that's it for us on Good Morning Nigeria for today and indeed for the week. We hope you join us on Monday for another edition of the program. Enjoy your weekend, stay safe, and be good. I'm Kingsley Osadolo.